College can be an amazing experience, but it will have ups and downs. Sometimes the downs are more than just temporary setbacks and can be a signal of a mood disorder like depression. Depression can look different in different people. Sometimes depression is triggered by something like the death of a loved one, breakup in a relationship, or failing a course. Other kinds of depression are low level and long lasting. Sometimes depression can be associated with anxiety. Being depressed can feel like you're a different person, and your friends or family may notice that something about you has changed. It's important for you to be aware of the symptoms because early diagnosis and treatment gives you the best chance for recovery. The longer you have depression and the more episodes you have, the longer they will tend to last and the more you will tend to have. So what should you look for? Changes in mood. Depression may not make you feel sad, but many feel a kind of blue apathy or irritability. Others will feel very down, often tearful for no apparent reason. Problems with sleep, sleeping more than usual, and problems falling asleep or staying asleep are very common with depression. Low energy. Often people with depression just want to stay in bed or do something mindless like watch TV. Losing interest in the things you love. Things that usually bring you joy like exercising, watching movies, or spending time with friends may lose their appeal. You may feel like you don't have the motivation to do anything. Poor concentration. Having trouble focusing can make studying and doing homework feel difficult or even impossible. Guilt and poor self-esteem. Most people with depression feel awful about themselves. Some feel a gradual decline in self-worth. Some grow frustrated with themselves for not being able to do the things they feel they're supposed to do. Changes in your appetite, and this goes both ways, either eating too much to comfort yourself or losing any appetite at all. Feeling agitated and jumpy, or that everything you do is going in slow motion. Substance use. People often turn to alcohol and drugs to feel better for a moment, but substance use will actually worsen a depression. Thoughts of suicide. Perhaps the most serious symptom of depression, suicidal thoughts may occur with or without intention or a plan. Someone with suicidal thoughts may feel hopeless or that life is just too much to continue. Sometimes, though, suicidal thoughts do escalate to making a plan. When this happens, it is imperative to get help from a mental health professional. The problem with depression is that when you are deeply immersed in it, it feels like there's no way out, that nothing can be done. This is the vicious cycle of depression. You feel awful, believe you are hopeless, get more depressed, and don't seek help. The fact is that most folks who take their life have a serious clinical depression or other mental disorder, and only about 1 in 4 seek help. So what can you do to get better? If friends or family notice that you've changed and ask what's going on, talk with them and try to be honest. Don't be afraid or ashamed. It's really common to fear that if you open up, you'll be viewed differently, excluded, or shunned. You might be surprised to find that many people understand what you're going through. Lots of people have been depressed or have known others with depression. Get help. This isn't something you can fix on your own. There are many ways to get professional help that is confidential, and treatment works. Counseling, sometimes with medication, can make a huge difference. Practices that contribute to overall wellness, like exercise, sleep, good nutrition, avoiding alcohol, and meditation can also make a difference. The bottom line is this. Depression is common, and if you're in it, it feels terrible. But hang in there, reach out for help, and things can get better.
Hi, I'm Gene Beresin, Executive Director of the Clay Center for Young Healthy Minds at Mass General Hospital. Thanks for watching this video. If you're struggling with a problem, reach out for help from a mental health professional. Remember, there are resources and people who can help you through it.